This is where the Manitoba government wants to put the province's first supervised consumption site. It would allow people to use drugs and would have staff on hand to respond to overdoses and suggest treatment. Marla Murphy is the manager of Ultimate Wheelworks near the proposed site.
Like, there's no reasoning with them when they're in psychosis, and to support something to enable them to partake of their illegal substances, which used to be illegal and as far as I know still is, to encourage that behavior and enable it just blows my mind.
That's one of the reasons Murphy and others oppose the site.
People coming in here, smashing the door, coming inside, vandalizing. Somebody tried to break in the side of the building on Friday. They set our entire compound on fire last year.
A recent study challenges that idea. McGill University Associate Professor Dimitra Pangiotoglou was part of the research published in the Journal of the American Medical Association.
Sometimes I turn around and say, that intervention that you're so passionate about doesn't have a huge impact at the population level. But it also means that, that intervention you're really concerned about doesn't track with the harms that you're suggesting it has.
The study looked at a decade of crime data around 9 supervised consumption sites that have since closed in Toronto. It found there were some increases of crime after opening, but over time, there were neutral to positive improvements in crime trends with the exception of break-and-enters.
And I think that's an opportunity to learn from what is working to better integrate services like this, both within Toronto but across Canada.
Murphy says the study doesn't change her mind.
I honestly don't think it's a good idea to have this anywhere.
Another business manager is encouraged.
If the studies isn't made and people have done it and it's at least improved the situation in any factor, then yeah, that's great news actually. So if we can see any improvement at all, I'd be happy to see that.
The province could have more consultations on the site, which would delay a January opening. Gavin Axelrod, CBC News, Winnipeg.